What are your thoughts on it?
Fusion surgery is one type of surgery performed on the low back or neck. However, it's one that is recommended only in certain circumstances. When you fuse the spine, you're linking vertebrae together, taking away mobility between the two vertebrae, and that's typically the cause for concern or hesitation when thinking about undergoing a fusion surgery if that's been recommended. What I've found in my practice is a lot of times there are situations that look like a patient might require a fusion surgery, but you can offer them a different procedure. Sometimes just removing a bone spur or a piece of herniated disc, even though the underlying structure of the spine is not normal or a little bit worn out, can still be successful. However, there are situations when fusion surgery is the preferred treatment for a problem in your neck or back. The most important issue to understand in a fusion surgery from a patient's perspective is if the area getting fused has normal mobility or not. In most of the situations where I'm recommending a fusion to a patient, it's because the area that needs surgery is worn out, collapsed, and is essentially rendered immobile. So what I'm doing is taking an area that is worn out and broken down and stabilizing it and holding it in place in order to create more room for the nerves to fix their neurologic problem. So what's really happening, even though I'm fusing the spine by putting in rods or in screws or a plate, is taking an area that really doesn't move. It's essentially vibrating or kind of rubbing bone on bone, but not providing any real mobility in holding it in place. And that's quite different than taking a highly mobile area that shifts and twists and rotates and then locking it in place. When that occurs, the patient will notice that things have been structurally altered. Typically, if something's significantly worn out and then gets fused, you're not going to notice a big change in mobility or function. There's actually been some studies that shown that after a fusion, particularly in the neck, patients will experience more motion in their neck following the surgery because the pain that limited them from moving their neck before the surgery has been eliminated, and they can use the remainder of their normal neck segments to their maximum amount.